Welcome to the Lifestyle Medicine Update on Dr. James Meschino. In recent lifestyle medicine updates, I've cited the research showing that individuals with a blood vitamin D level above 75 or 80 nanomoles per liter and below 140 nanomoles per liter were in the best position to prevent viral-induced respiratory tract infections and or to reduce the severity of the infection should one arise. Now, regarding the COVID-19 virus, early observations showed that European countries where blood vitamin D levels are known to be low have been the hardest hit regarding deaths from COVID-19. Now, in May of 2020, an updated report was published in the journal Aging Clinical and Experimental Research, which highlighted the increasingly strong link between low vitamin D levels and increased risk of death from COVID-19. So the researchers explain that the European Calcified Tissue Society Working Group has defined severe vitamin D deficiency as a blood vitamin D level lower than 30 nanomoles per liter means you have a severe deficiency. So anything below 30 nanomoles per liter is considered a severe deficiency of vitamin D. Remember that an ideal value is between 80 and 140, but severe deficiency is below 30. Nobody should have severe deficiency. The Seneca study showed that the average vitamin D blood level in older individuals in Spain is 26 nanomoles per liter, and in Italy it's 28 nanomoles per liter. This is disgraceful. Whereas higher vitamin D levels of 45 nanomoles per liter are found in Nordic countries. In Switzerland, the average vitamin D level is 23 in nursing homes, and in Italy, 76% of women over the age of 70 years of age have vitamin D levels below 30 nanomoles per liter. These are the countries with high number of cases of vitamin D of COVID-19, and the aging population is the group with the highest risk for morbidity and mortality from COVID-19. The researchers state that vitamin D deficiency is a major public health problem worldwide in all age groups, but vitamin D status deteriorates with age, above 70 years of age especially, due to decreased sun exposure and decreased ability after the age of 70 for the skin to synthesize vitamin D even if you're exposed to the sun. Vitamin D status is especially poor in institutionalized people in nursing homes, 75% of them being severely vitamin D deficient with blood levels of vitamin D below 25 nanomoles per liter. This is terrible. The researchers go on to state that the southern European countries have lower blood levels of vitamin D compared to northern European countries because of decreased sun exposure. Even though they get more sun because they're further south, they tend to stay in the shade to avoid the sun. And they tend to have darker skin compared to northern Europeans, which reduces the amount of vitamin D that's made in the skin upon exposure to sunlight because the melanin pigment in the skin acts as a sun shield. In Northern Europe, the average vitamin D blood levels are higher because they know that they don't get enough sunlight year-round to synthesize the required amount of vitamin D to prevent osteoporosis, so they consume cod liver oil, very rich in vitamin D, and they take vitamin D supplements, which are very inexpensive, and they fortify their milk and milk products with vitamin D. This really arose out of Finland, where they do this extremely well. Regarding immunity, vitamin D is required by various immune cells to ward off and fight dangerous viruses and bacteria. As well, low vitamin D levels enable certain immune cells to overreact to viruses by creating the cytokine storm, which is often the life-threatening event which causes organ failure and death. Vitamin D also modulates the function of the ACE enzymes in the lungs, helping to prevent the virus from mounting a highly virulent and permanent lung-damaging respiratory tract infection in the lungs. I believe that it's just common sense at this point to ensure that your blood vitamin D level is above 75 or 80 nanomoles per liter and below 140 nanomoles per liter. Now, if you have an autoimmune disease or you're fighting a certain type of cancer, your doctor may want to see higher vitamin D levels than 140, but for most people, between 80 and 140 is the sweet spot to shoot for. And most people can achieve this by ingesting 1,000 to 3,000 IUs of vitamin D per day. But you should get your blood vitamin D level assessed by your physician to make sure you're getting enough vitamin D each day to achieve a blood level of at least 80 nanomoles per liter, but not so much that you're going beyond 140 unless otherwise indicated by your physician. Now, some blood panels show vitamin D in nanograms per milliliter rather than nanomoles per liter, in which case the sweet spot is between 32 and 56 nanograms per milliliter. I've included the reference for this information in the text below. Thanks for watching, and I'll see you next time.